Hello, everyone. Welcome to yet another session on Module 3, that is Indigenous Sciences and Mathematics. Now, looking back on Lesson 3.1, where we had talked about Aryabhatta and Bhaskara as the key mathematicians and astronomers of ancient India, we had seen that Aryabhatta's contribution to mathematics was magnanimous. The system of geometry, the system of algebra, which came into play and came into being, was very, very important. Now, before that, we had also seen the architectural need of geometry and algebra in it, where we had seen that altars that were made were very specific geometrically, and for various rituals, they were different, their purposes were also different. And then we also saw that how astronomy goes hand in hand with mathematics. There were so many theories which were propounded then and which continue to remain. Then we saw that Bhaskara also, though he came about a century after Aryabhatta, but he continued to explore more on the Aryabhatiya, the treatise that was compiled by Aryabhatta, and he went on to further delve into the complexities of mathematics, of algebra, of geometry, and its correlation to astronomy. All that astronomy holds good these days has its basics there in the ancient knowledge system that we bear and we carry with us. Let's begin with lesson 3.2, where we are going to talk about two noble figures of the ancient world, that is Charaka and Sushruta, and their contributions in medicine. Charaka and Sushruta are two of the most revered figures in ancient Indian medicine, particularly in the Ayurvedic tradition. Now, of old, there was only Ayurvedic medicine which was available because that was the closest to nature. That is the treatment that nature could give then, and it still gives, but then it was very important because that was the only source to seek medicinal aid and treatment. They are often referred to as the father of medicine and father of surgery, respectively. So, Charaka was the father of medicine because he began with the Ayurvedic series of medicines, and Sushruta was the father of surgery because he delved into surgery as old as ancient India. So, then also he may have devised tools for the necessary surgical methods that he used. For their groundbreaking contributions recorded in their foundational texts, the Charaka Samhita and the Sushruta Samhita. Now, these were books that were written by both of them, respectively, Charaka Samhita by Charaka and Sushruta Samhita by Sushruta. So, these books entailed the different kind of theories that they had, the different kind of, in case of medicine, the different kind of treating ailments that he propounded. And for Sushruta, it included the various kind of surgeries that he delved into and he undertook with the limited resources of those times. So going on to the Charaka and the Charaka Samhita. Now, even in modern day India, that Maharishi Charak was is still very famous. That if you look at this statue of his, that is a modern day statue which has been put up. So naturally, for a person to have a statue installed at a prominent place, the contribution may have been magnanimous then and magnanimous now. So the focus of his medicinal approach was on internal medicine and holistic health. Indian internal medicine and holistic health both encompass a person's well being. So he was not only careful about the medicine aspect of it, but also an individual's approach to how the medicine would work on him. Charaka's work primarily deals with Kaya Chikitsa, that is internal medicine, medicines that can be consumed, and whatever the effect that they have, whatever remedial effect that they have, it was based on that. So, Kaya Chikitsa, internal medicine. He emphasized a holistic approach to health, stressing the importance of lifestyle, diet, and maintaining balance among the three doshas. Now, what are the three doshas? It is Vata, Pitta, and Kapha for preventing and treating diseases. Now, when we go to any doctor of modern day times, that particular doctor also does highlight the importance of our lifestyle, the kind of diet that we are maintaining, and the kind of balance that we have in our internal system. They do ask you what kind of a diet chart you follow. We have got dietitians these days. So, where did all this come from? This has already been there and it has been followed rigorously from times immemorial. Detailed diagnostics. The Charaka Samhita outlined elaborate diagnostic methods, including examination of the pulse, the tongue, and urine to determine the nature of disease. Pharmacology and herbal medicine. Charaka provided extensive knowledge on the preparation and use of medicinal herbs and minerals, laying a foundation for pharmacology in Ayurveda. Now, at that point in time, medicinal herbs were prevalent. They still are, but that is how he began discovering how the medicinal herbs and the minerals, the natural minerals, combined together can heal and cure various diseases and various malfunctions in our body. Emphasis on prevention. Charaka was a strong proponent of the prevention is better than cure doctrine. We still use that idiom very often, advocating for a strict code of personal and social hygiene, bodily experience, exercises, and adherence to seasonal rhythms for overall well being. Now, adherence to seasonal rhythms means that we live in a country where we largely see four types of climate. We have a winter season, we have a summer season, we have a rainy season, and we have a spring season as well. So, all these climatic conditions brought about weather change disorders in human beings. So, he was mindful of the climatic change, and we too need to be mindful of the climatic change, the kind of food that we consume, the kind of clothes that we wear, the kind of lifestyle we need to adapt while the climate around us is changing. Medical ethics and patient care. The Charaka Samhita also touches upon medical ethics, emphasizing the physician's responsibility, consent, and the importance of teamwork between physician, nurse, and patient for recovery. So all these components have to still, in modern day times, have to work in tandem. The physician has to work in tandem with both the nurse and the patient so that the patient can feel well again. Correct monitoring has to be done so that the desired result or objective of a person's good health is achieved. Anatomy and physiology. While not as detailed as Sushruta's work, Charaka also studied the human body, providing insights into anatomy, the functions of organs, and the concept of channels, like the 13 main channels connected to the heart. Now, without knowing the connect, he could not have purposefully made medicine. So, he did have equitable knowledge about the organs and the concept of the channels so that he could talk about medicinal herbs and minerals in the right composition to cure the right amount of disease. Okay, so the next is Sushruta and the Sushruta Samhita. Again, Sushruta was as credible as Charaka because Sushruta too has his own glorified statue in Goa. And again, people who have gained popularity for their work, for their credibility, have their statues in important places. So, as the father of surgery, he has his statue installed there. Pioneer of surgery. Sushruta is renowned for his surgical innovations. So, now in times like those, who could have thought that surgery was even remotely possible? But yes, it was possible. There is sufficient amount of proof, and that is the reason why he is being called the father of surgery. The Sushruta Samhita is considered the earliest comprehensive treatise on surgery in the world. Not only in India, in the world though. Surgical procedures. He described a wide range of surgical procedures categorized under 8 heads: Chedya, excision; Lekhya, scarification; Vedhya, puncturing; Aisya, exploration; Arya, extraction; Visarya, evacuation; and Sivya, suturing. So, all of these, the excision, the scarification, the puncturing, the exploration, the extraction, the evacuation, and the suturing, are very important parts of a surgery still, and they continued to be important aspects of surgery. But it is mindfully seen here that all these procedures under different names were carried out then also, and their importance was there then also. Plastic and reconstructive surgery. Now, who would have thought that plastic reconstructive surgery would have been possible with a limited kind of resources, with a limited kind of tools, then also? People now also would think twice about getting a plastic reconstructive surgery, let alone in ancient times. But then, when we call him the father of surgery, he truly was the father of surgery. One of Sushruta's most remarkable contribution is his detailed description of reconstructive surgery, particularly rhinoplasty, nose reconstruction, using cheek or forehead flaps. That is the skin which is delicate and that is used for rhinoplasty. This technique, known as the Indian method, later influenced modern plastic surgery. He also detailed procedures for repairing earlobes and cleft lips. So, cleft lips, we may know that sometimes lip is a deformity from birth, and if it was corrected then, it sure can be corrected now as well. So, cataract surgery. Sushruta described a form of cataract surgery using the couching method, where the lens was dislodged to restore vision. So, cataract surgery also, that people suffered then because it is it is a natural process. So, there was a cure then also, which he called the couching method. Surgical instruments, which were imperative and very, very important and useful during all these surgeries. So, let's see how he managed them. He designed and meticulously described over 100 surgical instruments. Hard to believe, but yes. Categorizing them into yantras, blunt instruments, and shastras, sharp instruments. These designs emphasized precision and practicality, some even mimicking animal and bird jaws for a better grip. Anesthesia and sterilization. So, anesthesia and sterilization are a very important step for any surgical procedure. Sushruta advocated for the use of intoxicants like wine and henbane for anesthesia during surgery. He also emphasized the importance of cleanliness, asepsis, sterilization in surgical practices. So, all this was done then also with whatever limited resources or with whatever make do they could have at that point in time. Cadaver dissection. Cadaver, a dead person's body. Sushruta stressed the importance of a cadaver dissection for aspiring surgeons to gain a thorough understanding of human anatomy. So, these days also, medical colleges we know that use donated bodies of human beings to practice upon, to be more precise, to be more accurate with whatever surgical procedure will be conducted or has to be done. Management of fractures and dislocations, which are common now, which would have been common then also. He provided detailed guidance on the treatment of 12 types of fractures and 6 types of dislocations, outlining principles of traction, manipulation, apposition, stabilization, and post-operative physiotherapy. So traction, if we think, is now, was there also in earlier times. Manipulation of the bones, apposition of the bones, stabilization of the bones, how we use so many ways and methods. Doctors try distended ankles to bricks, or they put it on a frame. So all this was there also. It may not have been so refined, but yes, there for the purpose of treatment. Here in this picture now, we see Sushruta performing a eye surgery. And if you look carefully therein, you see several tools. Now they said that there were blunt ones, which were non-abrasive, and there were sharp ones, which were basically for cutting and clenching. Then you see tools which are like pliers. They say that which were shaped like the jaws of animals and birds, so that clenching would be easier. So we see limited number of tools here, but the theory does say that he made at least 100 tools which helped him in his surgical profession. So with this we finish lesson 3.2, but this was quite an enlightening lesson where we saw that both Charaka, the father of medicine, and Sushruta, the father of surgery, were very, very good in their work. Their knowledge were astounding then. The use of things also was astounding, because who would have thought that a cataract surgery, a dislocation, or even plastic surgery could have taken place then. But yes, with their expertise, with their skill, with their dedication, with their knowledge of the subject, things were made possible. They made it possible. The holistic living, the internal medicine that Charaka went about doing was may have been a lifesaver then. And so must have been Sushruta's surgical procedures, which brought about new life and help to people in those olden times. So with that, we finish lesson 3.2. Thank you.